we go down different pathways depending on what the history and exam tells us.
Yeah, and I really like that point, because I think that sometimes when somebody comes in with fibromyalgia symptoms, it can be a little overwhelming for the clinician.
It can.
One response can be just to throw out a slew of tests, but really what you're suggesting is a more sequential approach to
Yes.
testing based upon what you learn in the history.
Right,
and in your
because
physical
when
exam.
you do the history and physical exam, particularly once you see a lot of these patients and you're experienced with it, you can make a pretty good idea or a decision right away. Does it really fit the criteria of really having a strong possibility of being classic fibromyalgia, one of these centrally mediated pain processing disorders, or is it clearly not that? And when it's not that, you actually have to do more testing, because there's a whole laundry list of things it could be. You know, you got to look at mitochondrial energy, biochemistry, you know, look at ATP production. You have to look more into adrenal stress, thyroid, you know, more subtle thyroid conversion problems, things like that. You need to look into toxic issues, you know, toxic burden, heavy metals. I mean, there's a lot of places you can go. And even some genetic testing. There are different directions you go based on that history. And don't do them all on everybody. It's just too expensive, and it makes no sense.
Yeah, and can be confusing.
Yes. Yeah.